So I guess my personal passion for wellness has been lifelong, and I always had this idea that it would be easier to prevent a problem than to fix it after it occurred. And then that sort of matured to the point more recently of understanding that personally when I feel well, when I'm sleeping well, managing my stress, eating well, being optimally physically active, I'm a lot more productive. As a clinician, one of the challenges I have is to take people who come in with musculoskeletal complaints, but then to take them beyond the idea of, so I've sprained my ankle, could you get it to feel better, to why don't we go a step further? Why don't we talk about how to prevent the next ankle sprain? And while you're doing these new therapeutic exercises, can we transform that into exercises that are going to help with your entire body, with your entire being, sort of talking about the rest of their life and sort of challenging people to raise their standards and to go to 110%. So I find that endlessly fascinating. And a real sort of hit for me in a good way is to take a patient who comes in with a problem, take care of the problem, and then put them on a new trajectory down the line where they're managing their weight, where they're being more active, where they're come back and report to me how their life is improving and expanding. With the proper training, with the proper venue, with the right platform, I can get other people to make changes. And that's really where, where my passion and my energy goes. And as a clinician, as a physician, as a doctor, I'm sort of frankly horrified by the state of medical education that we're not taught the most fundamental aspects of how to get our patients to maintain and to improve their health. So I've dedicated myself fully to engaging clinicians, actually across the board, not just physicians anymore, to train them, sort of simply put, retrofitting doctors for I can't even call them new realities. These realities have been with us forever, that it's the behaviors of our patients that is pushing them in the wrong path. One of the parts that pulls these issues together is there's wonderful literature that shows that what I do as a clinician, how healthy your physician is, will directly translate into your personal health. And great evidence for that. So that's very compelling because so many doctors and nurses are frankly burnt out. And the idea of having the allowance, the imperative to keep themselves well, with the idea that it's going to improve the health of their patients is extremely compelling to me. My realm generally is working with patients directly as a clinician, working as a leader, a thought leader in the educational reform for physicians and all clinicians. And I realize that those things have to happen in order for the changes to occur, but we can't do this alone. So what I'm excited about on the Scientific Advisory Board is to bring in what I believe to be sort of the catalyst to really propel the success of Onlife by actually including the clinician in the conversation.